Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Now we have Dr. SHAWN Norris, who is a certified foot and ankle specialist. So welcome to our show, Dr. Norris.
My pleasure. Thanks for having me.
You know, Dr. Norris, when we think of, we used to call them podiatrists. And I don't know, is it different to have a podiatrist compared to a certified foot and ankle specialist?
We are podiatrists. That's the name of our practice. But podiatry has come a long way, over the last several years. The training is quite a bit different than it used to be. People's concept of what podiatry, is probably fairly antiquated. These days we actually we have a 4-year medical school program that's dedicated on the foot and ankle. And then we also complete a 3-year surgical residency following that, so that we do complete orthopedic surgery of the foot and ankle.
And I'm so glad you're here because as one ages, it seems like our feet are the worst things that happen to us.
Absolutely. I hear that every day, all the time. It says, I've never had a problem with my feet my whole life, and all of a sudden they hurt all the time. Yeah.
I actually I had another friend, she was a podiatrist, and she said, well, what we can do, because when I wear shoes, I'll go back on that, but let me just get rid of this one first because I was waiting for you to come this morning, because she said, we'll take some fat from another place and take the bottom of your feet and put more fat because you've lost fat. I said, are you kidding? I'm not going through a surgery like that. Is that all you can do?
No, there's a lot of things that you can do. I think that trying to move fat around the body might be a kind of a last resort for that problem. but a lot, there's a lot of things that we can add to the outside of the foot. And in addition to surgery, we can modify the shoe gear. We do a lot with inserts and padding and offloading of painful areas, because as you age, you are going to lose that fat pad on the bottom of the feet. So that's really what it is, isn't it? In a lot of cases, it is. You'll have a very prominent ball of the foot or a prominent heel. And so shoes that used to be comfortable are no longer comfortable. So we just have to modify those or add some extra padding to them.
So you can do that, and that's good enough. I mean, and also, don't your foot sizes change?
Your foot size can change relatively, as ligaments expand, as deformities occur. And so a lot of people say, well, I used to be a size whatever, and now they're half a size bigger.
Right.
And they get caught up with the number, but it's just more important to find a shoe that's really comfortable for you. And there's different things that can be done with that.
Well, and of course, as a podiatrist, you must just shudder when you see some of the new heels that these women wear, these blazers. I mean, they're
yeah, exactly. Because a lot of people come in complaining of foot pain, and then I see the type of shoe they're in, and sometimes it seems like the answer is fairly obvious, but it's just tough to get people to change, what they like to wear.
But I want to tell you something. I modeled for about 30 years, and I always had high heels, and I never had foot problems at all. I am more comfortable in heels, and you're going to give me the reason I know, than flat shoes. And I guess that's because my calves or something's changed.
Yeah, there's a couple of different things. Sometimes with a heel or a wedge, it kind of provides a natural arch support. So if somebody's having pain on the bottom of their foot, that can definitely help kind of support that. But the other reason is true. I mean, calf muscles, especially if you've been walking in heels, tend to contract. And so when you go into a flat shoe and you're asking that Achilles tendon to really give and lower the heel to the ground, that's when people start placing extra stress on the bottom of their foot, maybe get cramping in their calves and things like that. And so in order for people to become more comfortable, we often recommend that they start a stretching program that really a lot of times focuses on the calf muscle, and it can alleviate a lot of the problems and discomfort in the foot as well.
Well, let's go over all the kind of people are sitting at home now and they're listening and they're saying, oh, my feet, I have all these questions. So what are some of the questions that they have all different things. They have corns, they have bunions, they have, Achilles heels. What are all the problems people can have with their feet?
It's incredible how many different problems you can have. I mean, you're right. It does kind of start with really basic stuff like, corns and calluses or, thick, fungal nails. Just kind of heel pain is probably one of the most common things that we see. It's probably accounts for 60% of
heel pain.
Visits that people come in for. Plantar fasciitis is the heel pain.
Oh.
Arthritis. The foot has has 28 bones. There's a lot of different joints, and so you get a lot of different places for arthritis. There's sports injuries. There's trauma. We see that a lot of ankle fractures, metatarsal fractures, and we have people that have these chronic flat feet that require reconstructive surgery. That their foot has degenerated over time. So it really encompasses a large spectrum. From things that are very simple, just palliative, care with the corns and things like that, all the way up to reconstructing, somebody's foot and ankle.
And there are people who actually have the toes, as one ages, seem to kind of bend down.
Yeah,
what is that called?
Well, we call it, kind of the broad term would be a hammer digit deformity, and there's different ways that the toes curl, but as we age, the intrinsic muscles in the foot, they weaken or they get overpowered by some of the extrinsic muscles of the foot, and it causes these different types of hammer digit deformities, which can make wearing shoes very uncomfortable. It can lead to painful corns on the top of the toes, and occasionally that requires surgery to straighten out the toes to get rid of those crooked knuckles.
Yeah, when we first started, if people can't walk, and that's the first thing they worry about, their feet.
Mm-hmm.
It paralyzes. I had an orthopedic surgeon that was this morning. So sure, he fixes the hips, he fixes the knees. Okay, now that's done. But they still can't walk because their feet are killing them.
And absolutely, and all of those joints are interrelated. So with implants and with rehab, sometimes that can slightly change the biomechanics, or the foot, or the improper biomechanics of the foot can influence those new joints that they put in. So you have to kind of look at the entire lower extremity. And a lot of times, after procedures like that, if they've developed any kind of a limb length inequality, sometimes we need to go in and make an orthotic for them to kind of level them out and kind of allow the rest of the legs and the body to work properly. So it's very important. If your feet hurt, they can't do the rehab they need to do for other things, and so we have to look at them.
Let's go back to what you just said on the orthotics. Now that seems to be very common. Mm-hmm. Talk about orthotics and who needs them and why and.
Well, orthotics can benefit a variety of different conditions, and there's different types. You see the over-the-counter type of inserts, which can benefit some people, but when somebody has a persistent pain or problem or abnormal biomechanic of the foot, we recommend a custom orthotic where we actually have the patient come in, we make an impression of the foot, and then from that impression we're able to make a completely customized insert that primarily will help support the arch of the foot, control the position of the heel, and then on top of that, we can make different modifications as far as little cutouts for painful areas or little pads to offload different areas, and so we can really customize the insert, which really makes it different than just something that you just go pick up at the drugstore. And and they address a variety of problems. What we were talking about earlier with just not having enough fat pad on the bottom of the foot. That an orthotic can be great for that. Arthritis. Heel pain, all of those different conditions can, greatly benefit from orthotic. Just about anybody could benefit from a custom orthotic if they have problems or in their foot.
And what are orthotics made of?
They can be made out of a variety of material, depending on what we're trying to do. For like a diabetic that has, peripheral neuropathy, we would make it out of very soft material so that they don't develop any irritation on the skin. They can be made out of cork and leather. For maybe a high-end athlete like a marathon runner, we can actually make them out of a carbon fiber or a graphite material so that they're supportive, but they're forgiving for a sports application. Or just kind of a general harder plastic for most of the orthotics. So a variety of materials, and it just really depends on what the problem is. And that's part of that whole customization of the insert.
When you go to these stores and you see the, miles, it seems like miles of Dr. Scholl's stuff.
Yeah, absolutely.
You know how many times I bought those things, I use it. They don't do anything.
Yeah, there are a lot of different products out there on the market, and every day that I see patients, they'll say, well, this new thing that they made, and there's millions of these things out there. So a lot of times I say you're going to have to bring it in because I'm not sure what you're talking about. So there are definitely a lot of things out there that you can find. Some work and some don't.
If you could invent something, what would you invent to do with the feet in your profession?
If you ask my patients, they would just ask for a new foot. That they could just pop it off and pop a new one on like
Which
a Mr.
foot
Potato
would you like?
Head.
Your
Exactly.
samples, right?
Probably the thing that I would invent most for the foot is Like your earlier guest was talking about, different types of joint replacements is, invent that perfect, ankle joint replacement. And they're getting very good at those these days. I mean, with the advanced imaging, they can actually take a CAT scan of your ankle and basically make a customized implant to put into your ankle. Before, it was a little bit more generic in the shape. Obviously there was different sizes, but, now they can be much more precise in the cuts and, actually making you a customized ankle insert or an ankle implant. And so, but it's constantly evolving, so that I think that would be a very exciting area to figure out that perfect ankle implant for somebody.
It's funny. I have never heard of anyone that I know anyway. I know that so many people had hips and knees, but I've never heard of anyone having an ankle implant. Why?
It's becoming more and more common. Part of the problem is that unlike the hip or the knee, the ankle is a very small joint, a very small surface area, and it bears a lot of our body weight. Depending on as you're walking, it's bearing, almost your full body weight. And so you put that much pressure on such a small surface area, that's asking a lot of that joint to do. And so in the past, in the 80s when they first became, fairly popular, there was just a lot of complications with the implants because they would kind of sink into the underlying bone, or they would kind of slip out of place, and so they fell out of favor for a while until some better designs came out. Now the designs that they're coming out with are extremely exciting, and they're lasting much longer. We're getting much more than that kind of the rule of thumb of 10 years. So we can put these implants in younger people, more active people, and people are doing great with them, because the alternative is fusing the joint, and then you end up with a very stiff, leg because your ankle's not bending. So I think you're going to start hearing more and more about ankle implants as time goes on. And our practice is a lot of ankle implants.
Huh. And how long does an ankle implant last? I mean, like the same as with knees and hips? Is it the same stuff?
It's getting that. It's getting up to those numbers, yes. I mean, we're getting much better results, after, beyond 10 years than we used to.
So, are these mostly from sports injuries? What?
They can be usually remote remote injuries. Somebody may have had bad ankle sprains in the past that it kind of altered the biomechanic of the ankle, and then through time, that joint not functioning very properly, they develop arthritis. And so that's typically what we're putting these implants in, is this end stage arthritis where the ankle's not bending, and they've tried conservative care like injections, bracing, and those things are failing, and then these patients aren't able to do the activities that you need to do, exercise and stay healthy. And so now we can put these implants in there, gets rid of their pain, and improves their function, and they can lead a much more normal life.
And so because that when you talked about the ankle, I thought, I don't know anybody. I know people who have sprained their ankle, but I've never heard any. Yes, that's very common. Okay, so are there supplements that we should be taking to help us with our feet and our ankles?
I don't think there's any magic bullet as far as it comes to supplements, but I mean, I think that obviously a healthy diet and exercise and good regimen of multivitamins are very important. As far as joint health, chondroitin and glucosamine have shown some patients they get some good benefit out of that. For our diabetic patients, there's activated vitamin complexes that can actually help reverse some of the peripheral neuropathy. And create additional nerve growth in the skin, because sometimes this neuropathy can become a very painful condition, can prevent sleep, just makes their lives very miserable, and they have to resort to taking very powerful oral medications to try to alleviate the pain. So there are some exciting new kind of supplements out there that can help with that.
I'm glad you brought up peripheral neuropathy, because with people who've had cancer, and it seems they all are affected by that.
Yeah, a lot of patients that have undergone chemotherapy will develop some peripheral neuropathy. Sometimes it's temporary and it goes away, or it gets to the point where it's not painful or it doesn't bother them, and some it's permanent. Probably our biggest population that has peripheral neuropathy is people with diabetes. That's the primary cause of peripheral neuropathy. But even unfortunately, aging, is another cause of peripheral neuropathy. They don't have any other, really identifiable, health problems, but, the older you get, the more likely it is that you're going to develop problems with your nerves. I mean, it's tissue like anything else that, can degenerate, and people will just come in there like, and I've got this numbness in my feet, or burning and tingling, and sometimes pain. And that's just it's a pain that's tough to treat. So we're very quick to identify that in patients. So it's very important to have foot screenings, and we test for the sensation of their feet. And when appropriate, start on supplementation. And if it's that, and if the supplementation doesn't work, there's different types of physical therapy that can be done that can help. And then sometimes it is the oral medication that's that's important.
You made me think of restless leg syndrome because I've heard that. So someone comes in, do you treat that in some way?
Yeah, we definitely we evaluate for that. And again, sometimes it's medication, sometimes it's they may think that it's a restless leg, and it's more that they're just not being hydrated and they're cramping a lot and they're uncomfortable at night. So it's just some part of the evaluation. And so again, sometimes medication is required, but we always try things conservative first. Anything that we can do that's non-medication and non-surgery, we absolutely try first, because there's no harm in that. And but we'll do what we need to do to alleviate the problem.
I'm glad I have you here because I want to talk about tennis shoes. I want to talk about
tennis shoes. Sorry.
They're all different manufacturers, different makes, and I've been wearing an old pair because they're so comfortable and they're falling apart, and I went and bought another pair and they don't fit right. So I need to go buy a good pair of tennis shoes to help me with this, please.
Yeah, that's something that we deal with a lot, because there are, like you said, there's a lot of different brands and styles out there. Probably, just as a general overview, what's important is that if you're going to be active with your tennis shoes, you're going to be running, walking, doing sports, that you change them regularly. If you're a runner, you need to be changing your shoes every 400 miles or so.
What do you mean? You mean buying a new pair?
Buying a new pair, yeah, because
Why?
You'll get these tennis shoes and they'll still look brand new, but you put 400 or 500 miles on it, or a couple of months of general exercise, and the structure of the shoe in the sole of the shoe is actually worn out, so you're not getting that shock absorption or the pronation control that the shoe is designed to do. And so the people exercise through these shoes, and all of a sudden that's when they start to develop their heel pain or their knee pain, because their shoes are wearing out. But the shoe itself may still look very very nice. So it's important to change those out regularly. But part of the problem too is that these manufacturers they'll start to change the style. So you find a style that you really like, and then you go to the store and they don't make it anymore. So it's it's very important to go to a store that the staff is trained in fitting you for the shoes. And because a lot of times you go to these places and the person that's selling you a shoe doesn't know much about it.
Absolutely, you're just so perfect.
So really, I would recommend you go to somewhere that they're trained very well to fit you.
You have a recommendation? I know you probably don't like to do this, but I need to go somewhere. Because
Often we'll, in our practice, because our practice here in Boca is close to the town center mall, and so we'll recommend the New Balance store or a store similar to that.
Oh, the New Balance store, because that's what I used to have. Balance, they're wonderful.
Yeah, they're great.
So there's
they
a
make
New Balance actually store in the mall?
Yeah. Absolutely.
Okay, well, I'll tell them you sent me.
and they do a very good job with fitting.
So they really that's the whole key. Years ago, I'm an older person. I used to go. They had these little things you put your foot in, and it shows how wide, how long. They don't do that anymore. At least not where I go.
Yeah, they definitely should get out with their little Brannick device or the measuring device. You need to be measured properly for it. Because in addition just to the length of your foot, you need to get the proper width, and that's where a lot of people run into trouble. They won't get the proper width, and you'll get calluses on both sides of your feet, or it kind of compresses your forefoot together, which can cause some nerve entrapment problems. And so, you have to get that proper width. You need to get the proper length, and so that's where a proper fit really comes into play.
I think the best place I ever went was a place that dealt with, I'm not diabetic, with diabetics, because they had special kind of shoes, and I think that's still the shoe I'm using, even though it's worn out. And then I was thinking going back to a place like that, although they don't have the same attractive. I want to get neons. I want to get
right.
Something,
Yeah, they may be a little bit more limited, but and even with my diabetic patients, because we recommend that they get a new pair of shoes every year so that they avoid problems. They're really coming out with a lot better styles. There's not just the black orthopedic shoe that everybody has in mind. So they are coming up with better styles. But they may not have all the neon colors that you can get at the other shoes.
Yeah, but it's funny because I have really been keeping. I've been keeping these because they're so comfortable and they're so wide and all. But if I told you, I'd be embarrassed to tell you they're probably 5 years, 6 years old.
Yeah.
I only walk in them though. I only do my walking.
Right.
So I mean, I'm not. Don't play tennis, don't do that. But you've convinced me. I'm going to go to New Balance, and if I get it just a little bit bigger, is that okay? Because I really like the room, or is that going to hurt me?
No, as long as the shoe is fitting around the mid portion of the foot and your heel's not slipping, it's okay to have that wider toe box, so you're not rubbing on your toes or jamming your toes into the tip of the shoe. I mean, it's just it's whatever's comfortable for you.
So
really.
you at your practice, you don't sell shoes. Did you ever consider that you ought to be doing that? I mean, that might be another get a store right next to you.
Yeah, maybe we need to do that. I don't know.
I think it would be a big profit business because I think we all would love to think that you know what you're doing and you're helping us.
Yeah, absolutely. We have to keep that in mind.
And get the neon ones.
Yeah, exactly.
Anyway, but that's great. So you're actually affiliated with Broward Health Imperial Point, my favorite hospital.
Yeah, absolutely. A great hospital. I really enjoy working there. I've only been on staff there for a little over a year, but I've had such a great experience there so far. Everybody I run into, from the doctors, nurses to the support personnel, absolutely wonderful. I love going to that hospital.
Yeah, no, you're right. They are. I love them too. I know that from the CEO down to even Joey. I mean, it's just
absolutely,
they are great,
absolutely. Yeah.
So let's go back to having because that's probably the most serious thing you do is you're having an ankle replacement. What do you use? What kind of I guess. Are you using anesthesia or are you using a spinal block or what do you do to? It's
very patient dependent, and that's where we have to really work closely with the anesthesiologist and kind of find out what's going to be the safest and the most comfortable thing for the patient. Sometimes we do this under general anesthesia, sometimes under a spinal or a regional block behind the knee. Typically, it would an ankle replacement or major reconstructive surgery of the foot and ankle requires a thigh tourniquet. So we would need to do something, a thigh tourniquet, a tourniquet that goes around the upper thigh. And so we have to make sure that you're comfortable. So generally, like a spinal would be more indicated in that point, or general anesthesia. Depending on the patient and any other medical issues that they may be having.
And what if someone needs? Is it common for someone to need both ankles done?
We would only usually do one at a time, but you can have, bilateral, ankle arthritis to the point where it's indicated. But in many cases, it's just one of the ankles because it's like the ankle that somebody constantly sprained, throughout their life, or maybe they had an ankle fracture at some point, and it was just a matter of time that they developed a post-traumatic arthritis from that. So usually it's one side, but it could be both sides. But we'd never do both sides at once because the recovery would be a little difficult in that case.
It would. My husband had both knees done at the same time, but that's different, isn't it?
Yeah, that could be a different.
Yeah, because you still have your feet to hold you down, right? So it's.
Well, and then listening to the earlier guests too. I mean, they've come a long way with those implants and the kind of the post-op rehab protocol. So it's. Yeah, so he was a brave man doing two at once. I don't know if I could do it.
Well, he did it because he knew someone said if you knew about it, you wouldn't want to go back.
Right.
So
I've heard that many times.
Ago.
Yeah.
His was 20 years ago, and he recuperated very quickly.
Great,
he's had 4
absolutely.
hips. I mean, he's now 91. That's my
Wow.
husband. He was a B-17 pilot in World War II, so I guess he's a tough guy.
He's a tough guy, absolutely.
But and they still work. I mean, everything.
Great,
he's
perfect.
in great shape. But being thin, he really keeps his weight very, very, good. And that makes a big. We haven't talked about that very much with you, but we did with the other doctor.
Absolutely. I mean, it's very important. I mean, your skeletal structure is only so big, and if you overload that with extra weight, you're going to put more stress on the joints. You're going to you can even kind of send those joints out of alignment depending on how you're carrying the weight. And so, a big part of of treatment of the foot and ankle of issues is weight control, but it's a catch-22 because people want to get out there and exercise to lose that weight, but if your feet and your ankles are too painful to do so, you can't lose that weight. So we kind of have to, kind of address the pains and problems along the way to allow for that weight loss because ultimately it's going to help.
Well, let's talk about water therapy now. So when you have your patients, do you suggest that they may consider doing that?
Oh, absolutely, all the time. We work with a lot of different physical therapists in the area, and We work a lot with physical therapists that have pools so that they can do that water therapy. And and a lot, and even if they don't need focused physical therapy, a lot of people live in places where they have exercise program at their community in the pool. And I recommend that all the time. If somebody's having a lot of pain in their foot or ankle, I want them to stay active. I want to keep their cardiac workouts up. I'll tell them to get in the pool. It's basically weightless, but you can still get your heart pumping and burn some calories.
That's good. Dr. Shawn Norris, and he's a certified foot and ankle specialist. We have to thank Broward Health Imperial Point for finding him. He's very smart, very nice. And Dr. Morris can be reached at 954-533-6396. That's 954-533-6396. And so we will be putting this interview on YouTube, so you'll be able to have your patients see how smart you are. And
Thank you.
we really thank you for coming in and doing this. And I learned a lot, and you've encouraged me. I'm going to go over and get some new. I know I've needed them, but I'm just putting it off. But I'm not going to anymore. And
all right, absolutely.
Yeah, and I'm going to go over because I did have a pair from the New Balance, and I really like them very much. What kind are you wearing? Are you not wearing?
I'm not wearing sneakers right now.
You're going to work, but you're going to do something, right?
Well, I'm going to get changed with my scrubs here in a little bit. I have a case this morning.
Really?
So, yes.
Well, thank you for coming here to do this.
Well, thank you for having me.